Dr. Russo in with us now to talk about hair transplants, and one of the key things that he's telling us is that some of the techniques have changed over the years. We're glad to have you back in. And, you know, while we were off camera, you were telling me some things I hadn't heard before. So some advancements have been made over the years.
Of all the areas that I've practiced medicine in the last 23 years that I've been doing my practice, hair transplant has changed the most. When we first started doing hair transplants, we used very large grafts that were designed to move as much hair per plug as possible. But we found out that that gave a very doll's head effect, this sort of a cornrow effect.
Right.
And now we've moved into the absolute opposite, where we literally are using the smallest grafts possible, with 1, 2, or maybe 3 hairs per graft, and we'll do as many as 2,000 grafts at one time.
You know, in the old days, when somebody had a hair transplant, you almost always knew, not only because, bam, there's hair where there wasn't hair before, but like you said, there was that sort of cornrow, sort of doll's head. But you put up with that as physicians. You guys put up with that for a long time.
Oh, absolutely. Because of the fact it was better than a hairpiece, and that it wouldn't fall off in the water or in the wind. But you had to do some styling and use some hairspray to make it look natural. And it's certainly, if you got in a swimming pool, it was very noticeable.
Right.
Nowadays, it's very different. I mean, you can get in a swimming pool, your hair wet, and you cannot tell. If it's done with the new techniques that we use now, you truly cannot tell that someone's had a hair transplant.
Just kind of describe for us the major difference in the techniques that you use now versus what you used then.
Well, in the past we used to use a little punch that we would take a little punch out from the back area about the size of a pencil eraser, and we'd do maybe as many as 100 of those little punches, and then the same thing in the front. We'd use another little punch to make a little place to put them.
Right.
Now we'll take a strip of tissue out in the back, sort of a little skinny, narrow strip of tissue in the back of hair that's not going to fall out. This hair back here is designed to stay as long as you're going to hold on to your hair. Right. Back here. You can take that strip, and then under a microscope, literally we use microscopes in the operating room. We have as many as 5 technicians in the operating room at the same time, and they're all sitting there dissecting these little hairs out under the microscope to make very, very small grafts. And then we'll just take a little needle and make a little needle stick up here and place that graft in that needle hole. So there's very, very small little needle puncture that heals just like a needle stick in your arm.
So when it's over, you get a fuller appearance.
Much fuller, much more natural, just a natural thick head of hair.
In the short time we've got, I got just a couple more questions for you. First of all, one of these things, you've got a lot of people who are doing this surgery all at once to make it happen like that, right?
Absolutely. It's a very coordinated effort in that we've got typically as many as 5 technicians, some of them sitting on the back table cutting these grafts up, the other ones standing over the patient's head making or placing the little grafts. Typically, of course I'm involved with key parts of the operation, but it requires a lot of people to do this.
Let's talk about the men and women. We know that men have been drawn to this surgery traditionally, but you also do the surgery on women as well, right?
Absolutely. Women don't publicize it as much because they will wear hair pieces and things to camouflage it that men don't wear.
Yes.
But there are a significant number of women that have quite a bit of hair loss, and so it's an area that is oftentimes pushed under the carpet. We don't talk about it that much, but there are a lot of women that really do have some problems with hair loss, and they will benefit by transplants.
Understood. If they want to get in touch with you, what's the best way for them to find out more?
Well, they can call our office. The office number is 930-9595, and the website is www.drrusso.com, DRROUSSO.com.
Dr. Russo, a pleasure to have you in.